My name is Dr. Kailash Mantry. I am a life coach and a mental health consultant. For the last 25 years, we have been researching on more than 100 mental illnesses which we have been able to cure with guarantee. Today we will be talking on cancer. The moment you listen the word cancer, it seems it is synonymous to death. The moment you hear that somebody has got cancer, the first thought comes, he may not live long. Now cancer is not 100% curable, but with cancer also, you can live long. Allopathy has been successful in postponing death up till the stage 3 of the cancer. Cancer is understood in stages. First stage cancer means it's an early sign and it is 100% curable, and the life expectancy can be increased by 20 years. Second stage cancer is slightly risky, but still with proper guidance, with proper treatment, life expectancy can be increased by 10 years. Third stage cancer is serious. Depending on which part the cancer is, chances are that the patient may not survive by more than 3 years. And the fourth stage cancer is a stage where nobody can help except we, but we also cannot help prolong the life, but we can make the person peaceful, harmonious, and we can create an atmosphere whereby he can die peacefully. There are more than 100 types of cancer, but broadly we can say there are 5 or 6 major categories. For ladies, more than 50% cancers are on sex organs. That means either breast or vagina or anus. For male, the major is lungs, and obviously because male are used to alcohol, smoking, tobacco chewing, and which aggravate the problem. Now let's see what's the root cause of cancer. The root cause of cancer is stress, anxiety, irritation, restlessness, suppressed anger, sadness, conflicts in relationship, disconnection with the family members. 80% causes of cancers are psychological, and 20% is sometimes genetic also. Sometimes it is due to past karma also. We have developed a very transparent test. We have named it mind mapping. This test is so transparent that the moment patients and the family members give the test, it is clear to them that cancer is basically due to stress. But parallelly they have to undergo 2 treatments. One is allopathy treatment and other is our treatment parallelly, because it's an emergency. Now what are the present treatments available? Chemotherapy, radiation therapy, surgery, hormone therapy, and at early stage sometimes drugs are also prescribed. Now how is cancer detected? Skin cancer or breast cancer are detected by having some lumps underneath the skin, and which are tested through biopsy, and it is concluded that the lump is of cancer or it's a normal lump. Now what are the signs and symptoms of cancer? Diarrhea, headache, constipation, fever, weight loss, weight gain, and there are many. Now what are the foods to be taken or foods to be avoided? Now what food to be taken if cancer is detected? Wheatgrass juice, salads, green juice, coconut water. What food to be avoided? Sugar is first thing which has to be stopped, not avoided, stopped. And you have to avoid pickle, spicy food, oily food, bakery products, dairy products, maida, etc. Now let's go by the statistics. Cancer is gender neutral. Ladies and gents both get cancer. But ladies' cause of cancer is always sex suppression, sex restraint, sadness, and gents' cause of cancers are always wrong habits, either alcoholic or tobacco chewing or smoking, and sometimes it is anxiety also, restlessness also. Medical science has really helped cancer patients to prolong death, but this prolongness of death is full of agony, suffering, heartburns, and painful life. Now let's discuss the facts. We are more India centric on the facts. Every year, more than 10 lakhs people are detected as cancer patients. 7 lakhs people die due to cancer every year. On an average, it is assumed that 25% people all over the world attract this disease, cancer. More than 75% people who are diagnosed as cancer die within 10 years. 40% people who get cancer are due to tobacco chewing. 20% people who get cancer are either into alcoholic or drug addict. 40% people who smoke, they attract cancer within 20 years of their life. Cancer is the second largest cause of death all over the world. On an average, every 30 seconds, one person dies due to lung cancer. And it's no surprise, if you see the sale of cigarettes, tobacco, drugs all over the world. Cancer is such a dangerous disease. It can spread within 48 hours to different parts of body. Now let's understand what is cancer. In our body, there are millions and million cells. If the cell get mutated, they attract other cells and it becomes a lump. This is the first sign, and biopsy is recommended to find the truth. More than 50% people above the age 65 are detected for cancer. 15% cancer is due to obesity also. 10% cancer could be due to personal hygiene or infection. Now let's talk about the myth about cancer. People say cancer is hereditary. It's a myth. It is not true. People say it is genetic. It is not true. It's a myth. Cancer is not a contagious bimari. It doesn't spread through touch. I once again repeat, 80% cause for cancer are psychological and emotional disorder, and that's why as the age progresses, the probability of getting cancers are more. Young children hardly attract this disease. So far, medical science treatment is restricted to chemotherapy, radiation therapy, hormone therapy or surgery. Nobody has seen this aspect, that it is more psychological and emotional, and we are the pioneer in treating cancer patients through our therapies. Even the last stage patients, even if he has got only 15 days to live, we can be of help to them. And if the cancer is at the first stage, we can guarantee 20 to 40 years of further life also. Second or third stage cancer also, we can help increase their life by more than 20 years. But they have to compulsory undergo chemotherapy and get it tested that there are no genes left in their body. There are no cancer genes left in their body. Once all the cancer germs are removed from the body, we can ensure for next 40-50 years that it will not relapse, and we have done it in the past. Cancer patients, before he is detected for cancer, if you see the lifestyle for the past 10 years, you will see there are a lot of anxieties, restlessness, sadness, suppressed anger, insecurity, fear, seriousness, negative thinking, overthinking, guilt, introvert nature, secretive personality, and many of the negativity which is revealed through our mind mapping test. And our job is to remove all this negativity and to install all the positivity in his mind. It is widely believed that people who are alcoholic, tobacco chewing, chain smokers are usually prone to cancer. But if you go deep into it, why people take so much alcohol, why people take so much smoking, why people take so much tobacco chewing? The basic reason is always stress, tension, anxiety, insecurity, fear. So, and these are all basically psychological reasons. So behind all physical reasons also, there are psychological reasons. Now sometimes people say overweight people also get cancer. That is also psychological. Why person eats more? Now woman, it is widely believed now that more than 50% cancer detected in women are on their sex organs, either breast or anus or vagina. And basically it is sex suppression. Nobody has seen this angle so far, but we have researched on more than 500 patients and our findings are authentic and logical. Now let's talk about breast cancer. 80% cases of breast cancer are in women who have late marriages or who finds it difficult breastfeeding their children. Thus, if I conclude, it's only incompletions of life which are attracting this deadly disease called cancer. And the second biggest reason is loss of connectivity with family members, loss of love, oneness feeling, acceptance from the family members. It could be from parents, spouse or children or brothers and sisters. There is one physical reason also for attracting cancer. If you are staying in an house in an atmosphere where there is a lack of oxygen or the air around you is very polluted, you can still attract cancer. Chemotherapy, radiation therapy or surgery, but yes, they are postponing the disease, and in between if the patient comes to us and is willing to change the lifestyle and get rid of all the past bad memories, he can lead a healthy, normal life. But definitely chemotherapy, radiation therapy and surgeries are the good things, and in emergency you have got no other choice but to go for it. But if you want to live long and live long healthily, you have to undergo our treatment also. Our treatment is for minimum 1 month, and every day 10 to 12 hours treatment is there. Depending on what stage you are, there is some variation in the treatment. But our treatment is basically to make you happy, to make you peaceful, to get you connected to your family members, to your relatives, to your friend circles, and to complete you from all your past bad memories. It is observed that 90% patients after taking the chemotherapy and radiation therapy or surgery, they are getting mentally prepared to die, and they are not willing to change their lifestyle, their thought process. They hardly meet any life coaches to design their life once again and to crave for love, peace and happiness. Our treatment normally is for 1 month and maximum 100 days. But now we have started an online treatment also for people who find it difficult to travel from all over the world. The treatment is done in 2 languages, English and Hindi, and the person need not come for residential treatment. They can continue taking parallelly, chemotherapy, radiation therapy, and along with that they can, take our treatment for 2 to 5 hours daily. And within 100 hours of our treatment, patient will start responding to our treatment. Our past experience says, if the person comes to us for a 1 month residential treatment, 30 to 40% improvement are seen on an average. But online treatment also is highly satisfactory, and 20 to 20% improvement can be seen in our online treatment. At the end, I will conclude that this is a psychological and emotional disorder, and they should meet a life coach. They should come to us for mind mapping test, and within 2 hours they will be convinced that still there can be juice in their life, still they can be happy, loving, peaceful in spite of whatever has happened in their life, and we can help them 30 to 40% in their recovery. I am Dr. Kailash Mantry, life coach and a mental health consultant from Mumbai, India.